So, how does pain actually become chronic or neuroplastic? Pain is created in the brain 100% of the time based simply on if the brain senses danger over safety. Anything that suggests you need protecting turns pain up, and anything that suggests you don't takes pain down. And I mean anything: life, family, work, politics. Anything that suggests that you don't need protection takes pain down. So that's Lorimer Moseley. Lorimer Moseley has written the book Explain Pain with David Butler. He's a physical therapist slash pain neuroscientist. He's got great stuff and explains the science of pain really well. So one study he did was he was poking people with a probe, and it was a cold probe. But what he did at the same time is he had them look at a blue, or he would light up either a blue or a red light. And what they found through all the studies and doing this with multiple people is that if the patient saw a red light, they would have significantly more pain than if they saw the blue light, right? Because the red light in our brains and bodies are typically like danger, hot, right? So the red light, literally, that is what caused more pain. It was that the brain sensed danger with the red light, and boom, more pain. The other study was that they put people in this, it's basically like the hair dryer that you sit in when you go get your hair done. And they had people sit in the hair dryer with this whatever hair dryer thing over the top of their head. And what they did was they had a knob in front of them. In the knob, they could see how much they were turning up, the intensity of this machine. They were telling them that the higher it is, the more likely, the more whatever pain they'll have. So as the person saw that number go up, their pain increased. And mind you, nothing is happening in this machine. But when the seeing it turned up, it was causing headaches. So these things to me, when I was learning about this, I was like, oh my God, that's amazing. Just that danger alarm signal. And that number, that volume number for the head stimulator headache study, that could be your MRI. That could be your X-ray. That could be your doctor saying, oh my gosh, you're bone on bone, or hey, you need surgery, right? Those are different things that cause you to feel like you need protection. And literally, that can turn your pain up, right? There's so many cool studies like that. So the other concept of understanding pain is hurt does not equal harm. And what do I mean by that? So, ouch, right? So this guy, had some trauma, but they didn't know that this was there until 8 years after this happened. So this man was in an altercation. This is in Tanzania, and he basically got in an altercation, and he went to go get help. And then when he went to the hospital there, they saw an incision, cleaned it up, and then sent him on his way home, right? They didn't do x-rays or anything at the time. And he did fine for 8 years, right? If we go to this other one, this guy actually jumped off things like a roof and landed on a nail. And you guys have probably seen this if you've again done some of the curable stuff. I'm sure someone's pulled this up at some point, but it was in the British Journal of Medicine. So he jumped off, landed on the nail, was writhing in pain, rolling all over the place, and then they took off his shoe, and the nail didn't go into his skin. It just went through both of his toes and just went through the boot. But what that guy with the boot had the perception of danger. So when he saw that, his brain was like, oh my gosh, danger, 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 pain, 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 pain. And that created real physical tension, muscle tightness, right? And then on the side with the knife is the guy never knew he got stabbed. He never saw it. He didn't sense the danger because he went to the hospital and got better. And the only reason they did the x-ray is because he was having like pus come out of his nipple, and he ended up eventually getting like an infection from there, so they had to do surgery. So when you're doing an activity or you're trying to get back into more movement, is understand when you have pain, yes, it's real, but really it's this overprotective mechanism. So that's why we say hurt does not equal harm. Even just thinking about the existence for why pain occurs. It's to protect us, like putting our hand in hot water and going, ow, that hurts, and then taking it out and being like, hey, pain, thank you so much for protecting me. That's what pain does. It is a protector. But when life gets hard and things get crazy, it wants to overprotect you.